Hi friends, good day to all of you. I am Dr. Phanipriya, specialist general and laparoscopic surgeon practicing at Prime Hospital in Dubai. Last time when I had a talk, I spoke about breast cancers, what a woman should know about a breast cancer and how she should go through the process of getting herself examined and evaluated. There were a few questions posted by some of you who have seen my video, and I have brought out a few more points which would be of help, and I'm sure I hope that I am able to address your queries. In case you still have more questions, you can post it after seeing my talk, and I would be happy to address all the concerns. I will be speaking about what a woman would go through once a breast lump is identified by her doctor. I commonly see women coming to me saying that they have a swelling in the breast. So I thought this would be a good topic to touch upon to let you know how I go about treating a lump in the breast. Let me talk in detail about the 3 steps in assessment of the breast lump. The first and the most important is a detailed history and a clinical examination by the surgeon. This by and large is the most important part of the assessment. The doctor would question the woman regarding various aspects in her life, for example, her pregnancy, breastfeeding habits, family history of any cancers, and also whether she has used any contraceptive pills or hormonal supplements. The importance of these questions, I think the surgeon will help you understand better. The second step in the assessment after a clinical examination would be a radiological assessment, which could be an ultrasound of the breast, a mammogram, which is an X-ray of the breast, and sometimes an MRI of the breast. The third step in assessment is a tissue diagnosis. Let me talk a little bit more about mammography. The common question that a woman would want to know is, should she undergo a mammography? As I had mentioned earlier, mammography is an X-ray of the breast. So there is a lot of fear about undergoing regular radiation exposures due to the X-ray mammography. Let me ask you a simple question. When a physician who is examining you asks for an X-ray of the chest, do you think twice to undergo an X-ray? No, right? But when it comes to a mammography, it is a lot of concern. I think it is the media hype which is causing this concern. But let me give you some more clarity about it. As per WHO guidelines, mammography is advisable in women as a screening procedure to look for breast cancer in women after the age of 40 years. So, it is recommended that a woman can undergo a mammography after age 40. So, what about the woman who is less than 40? Say there is a woman who is 35 to 36 years old, she has a breast swelling. Should she undergo a mammography? Well, that will be decided by the surgeon who is examining her. Going about all the evaluation, the surgeon will decide whether a mammography is essential, and if it is essential, she must undergo. By only 35, we see women who are 25 years of old, 25 years of age having breast cancers. So, when there is a suspicious lump in a woman, a mammogram is definitely advisable and it is perfectly safe to go through it. Next radiological investigation is an MRI of the breast. Well, an MRI has a lot of limitations and definitely does not give a lot more information than a mammography. So a mammography is the first step in diagnosing a breast swelling. When a mammography does not give clear information, only in those small proportion of patients an MRI of the breast is advised. So again, let your surgeon examine and then decide which is the best modality that you should undergo. After the radiological investigation comes the third, the most important, is the tissue diagnosis. Now, tissue diagnosis is direct access to the breast swelling and getting some material which can be tested under the microscope. The first and the most simplest procedure is FNAC, meaning fine needle aspiration cytology. As the term mentions, there is a small needle which is passed through the lump and a small amount of cells or fluid is removed and tested under the microscope. If this procedure is not able to conclusively tell the nature of the lump, then you will be subjected to another procedure which is called as a core biopsy. In a core biopsy, a thicker needle is inserted through the breast lump and a chunk of tissue is removed and subjected to microscopic examination. Now, this definitely gives a much clearer information about the nature of the swelling. The limitation here is, however big the needle, only one aspect of the lump can be approached. The rest of the breast lump cannot be approached, right? So then what? If this test does not give us definite evidence, then the next step is to undergo an excision biopsy. Well, excision biopsy means you undergo a surgical procedure, which is definitely more invasive than the other two and definitely is given only as the last resort. I hope I have given some information which is of value to you with regards to the treatment of a breast swelling. I would appreciate any questions or doubts from you. I will be happy to answer them. In my next talk, I would like to talk more about how we treat these lumps. That is the treatment. Till now, we have only talked about the diagnosis. Thank you, friends. Till we meet again. Bye.